Good part of the day, dear students. This is Aminova Nigina, and today we will be talking about gingival inflammations. If we start from introductions, there are four different stages of gingiva. The first one is initial, and the second one is early lesion. Third one is established lesion. And the last one is advanced lesion. Here in this presentation, we are going to talk about each stage of gingiva. Gingiva. And in the end of the lecture, you can test your knowledge. So let's start. Stage 1, initial lesion. The first manifestation of initial lesion is vascular changes. So the blood flow increased and dilated capillaries. Initial inflammatory change due to microbial activation of resident leukocytes, subsequent stimulation of endothelial cells, and the subclinical gingivitis. If we investigate the body cells under the microscope, we can see the widening of small capillary granules, adherence of neutrophils to vessel walls. You can also see exudation of fluid from GS, and the extravascular protein are present. In stage 2, in early lesion, guys, what evolves from the initial lesion. It evolves from the initial lesion, and after 1 week of plaque accumulation, you can see erythema, bleeding on probing, gingival fluid flow, transmigrating leukocyte, maximum 6 to 12 days. These are the early signs and symptoms. When it's under the microscope, right, and the microscopic examination, you can see the leukocyte, some neutrophils, macrophage, plasma cells, mast cells, JE densely infiltrated with neutrophils, and they show development of red peaks and ridges. Stage 2, in early lesion, you can also see 70% collagen destruction around cellular infiltrate, and circular dentogingival group fibers mostly affected. In stage 3, in established lesion, guys, after accumulation of plaque, 3 weeks after accumulation of plaque, stage number 3, gingivitis, established lesion happens. Predominance of plasma cells, creation of small gingival pocket lined with pocket epithelium, B cells predominantly, result localized gingival anoxemia, bluish on the reddened gingiva. In established lesion, we can also see the increased level of beta-gluconides and other oxides, decreased neutral mucopolysaccharides. Sorry for pronunciation. Next, in stage 3, microscopically, we can say increased number of plasma cells, JE, widened intercellular spaces plus granular cellular debris, including lysosomes. So this lesion is reversible after successful periodontal therapy. So there is still the hope. In stage 4, guys, in advanced lesion, phase of periodontal breakdown happens, extension of lesion into alveolar bone, microscopic, you can see fibrosis of gingiva, widespread manifestation of inflammatory and immunologic tissue damage, plasma cell dominance in CT, and neutrophils dominates in JE. So here we can come to the conclusion that initial lesion lasts from 2 to 4 days, and the predominant cell is PMS. And blood vessels are vasculitis. In early lesion, you can see the change in lymphocyte, which becomes the predominant cell, and the GE and CSE are the same as stage 1. However, blood vessels become vascular proliferation. In established lesion, which lasts from 14 to 21 days, plasma cells show the predominance, and collagen continues, the continued loss in collagen. Change in color, size, and texture can also be seen in this stage. So from this slide, actually, you can test your knowledge. And in case you don't know an answer to any of these questions, you can actually approach your lecturer and ask, and yeah, actually improve your knowledge. Here we are going to say goodbye, and yeah, have a good day and good luck with your studies, guys.